Hello. How is everyone? We are going to, if you have any questions, just put them into the chat. So if you can just pull up the chat right now and let me know if you can see me or hear me, just type in yes. That would be awesome. And welcome, welcome. Okay, just trying to make sure everything is set up correctly and we will get started. All right, so I'm going to go ahead and share my screen. Let's see what we got here. Whoops, okay. I can do this. I share screen. We're going to pull up the slides here. There we go. And then let me get this in a better view. All righty. How to have a strong core in pregnancy. I am so glad you're here. This is a really important topic. Um, I am Talia. I'm a pelvic floor physical therapist. I specialize in pregnancy and postpartum. I own a clinic here in Albuquerque, New Mexico called Holistic Pelvic Health, and I'm actually sitting in our gym. We have a little bassinet for babies that come in and some mirrors, and that's why it looks like this. So welcome. Today we're going to be talking about what it means to have core strength in pregnancy. So I am 35 weeks pregnant. If you are pregnant, let me just see if I can pull up the chat. Then just type into the chat how many weeks you are and if it's what if it's your first pregnancy or what number of pregnancy this is. I just want to see where everyone is at. And let me close that out. I think I have not totally figured out how to use the chat and the screen share at the same time. Okay, so being pregnant is intense. Our abdominal wall is growing and it's expanding all the time. Oh, I got something in the queue. Let me see if I can open that. 14 weeks first pregnancy. Congratulations, Kristen. Okay, so awesome. Um, so our abdominal wall is expanding all the time. Our pelvis is kind of changing all the time. And yet we are still needing to meet the demands of life. I know that seems like super basic and straightforward. Um, but it does get really hard. And life with children is really, really physical. So with your first kiddo, if you don't have a very strenuous job, things like that, then it can be maybe a little more manageable, just focusing on going to the gym or whatever it is that you're doing to stay active and healthy. But it still is really important because you're still expanding in this pregnant way. And if you have kids already, then you know that you're actually going to be needing to lift weights. My toddler is like 30 pounds now. And yeah, I still need to put her in the car seat. I still need to pick her up if that's really necessary. I still have to crawl around on the floor and get up off the floor, and it's super physical. And that does not even scratch the surface of, you know, postpartum when you give birth and suddenly you have to haul around all this plastic stuff like a car seat and a stroller, and I held my baby, in my carrier for like her whole first year. It was just so crazy. So you're bending over, you might be bending over a crib or a bassinet and lifting things up. And so this is all freshly after, almost a year of your body changing. And so we really want to make sure that you're as strong as you physically can be during pregnancy. I mean, it's not just about postpartum rehabilitation. It's keeping your abdominal wall online throughout the whole thing. And so I'm super glad you're here. This is going to be really beneficial. Let me just see if I can figure out where my cursor went. Oh. Okay, I cannot. All right. What's going on? My computer like froze. All right, I'll have to figure that out after. Sorry, everyone. I want to look at the chat and the Q&A, but we'll just wait until after. And so because right now my computer is kind of being a little bit crazy. So let me just get going with the content here, and then I'll see if I can figure this out a little bit later while y'all are putting in your questions. Okay, so when we are nice and strong in our core system, um, we will have less risk of pelvic pain during pregnancy and back pain during pregnancy. We will also have improved outcomes as far as like leaking pee during pregnancy or risking pelvic organ prolapse, which is where your organs in your body might start to descend down vaginally and maybe can even protrude or become heavy in the vaginal opening. And it will also decrease our risk of a prolonged diastasis recti. So diastasis recti is the separation of the abdominal wall, and it's very, very normal. It's like 100% going to happen in your third trimester, but we just don't want it to be lingering postpartum. Oh my gosh. Okay. Sorry, everyone. I may have to, okay, there we go. Let's see. Oh, there we go. Alrighty, there we go. Anything in the chat? Can you all, it looks like maybe the Q&A is a better place to put in whether or not you can see or hear me well, because it looks like the chat isn't really filling up with anything. So if you can see and hear me pretty well, just type that into the Q&A, and then I'll come back to our slides. Okay, here we go. I'm sorry, everyone. I promise you, I was practicing this and here we go. Oh, here we go. Okay, the Q&A is showing up now. All right, yes. Okay, the chat shows disabled. Is it? Okay, let me see. Thank you, Kristen. Why are you doing that? All right. I'm just gonna get rid of these and then come back to Q&A. Let me see what's going on in the chat. Should we? Okay, we'll just use the Q&A then. So if you have questions as we go along, just put them into the Q&A and I will see if I can answer those as we go. Okie dokie. So let me just open this up. Alrighty. Okay, so what is the diastasis recti? So it is the separation of the most superficial layer of the abdominal wall, or the rectus abdominis. So if you're looking at this picture, you can see that there's like the six-pack abs, and they will spread in order to accommodate the baby. And that's just going to happen. That's normal for the third trimester. And postpartum, it should resolve spontaneously to about a 2-finger width gap within 6 months postpartum. And I would say even 3 months, I kind of want to see that. But, hormones are changing, up until the 6 months mark. So it's possible that it could take a little bit longer. But if you're having more than a 2-finger gap, then that's something that you're going to want to address through some sort of intervention. So, doing a lot of good core work during the pregnancy is going to help decrease, the risk of that basically lingering or becoming problematic postpartum. Um, so, we're really looking at coning or doming in the abdominal wall during the pregnancy. Um, if you've already seen a little bit of that, then that is some diastasis. And we kind of want that to start in the third trimester. So if you're seeing that really early on, that could be another reason to start strengthening your abdominal wall um, pretty well during the pregnancy. Um, so here's another picture of layers of the abdominal wall. So we have four layers in our abdominal wall. We have our superficial, our six-pack abs, and then we have kind of the connective tissue that surrounds it and connects it. We have our obliques. So we have two different layers of obliques, and then at the very bottom of it all, so the deepest layer we want to say is transversus abdominis. So transversus abdominis runs like horizontal fibers like this. And it connects all the way from your spine all the way around baby through the front. And so transversus abdominis is a postural muscle, just like your diaphragm, just like your pelvic floor. We're not going to talk a whole lot about the pelvic floor, but your core system is really made of your diaphragm, your pelvic floor, and your transversus abdominis, your deepest core. So let's think about it like this. If I were to do a bunch of breathing exercises, I wouldn't really get sore. Um, but I might have just, I know that I did a bunch of breathing exercises and I'm working on my breathing and there's all these other benefits to it, but it's not like I felt like I did, 100 crunches and I'm sore and I felt work happening. It is, excuse me, the same concept when it comes to making sure our deep core is strong because all of these muscles, transversus abdominis, diaphragm, pelvic floor, they all work in that same way. They're kind of always working all the time. The thing that can happen is for a variety of different reasons, whether it's in pregnancy or not, this happens to men, this happens to kids. This isn't just a pregnancy problem, but we are especially prone to issues around this because of pregnancy, obviously. But the diaphragm can't expand well, then the transverse abdominis won't contract well, pelvic floor may be impacted as well. All of them work together as a system. So it's important that they all function optimally. And they all help to manage pressure in our core system. So when I'm talking about pressure in the core, what I'm talking about is the amount of force that goes into this little abdominal area that we're looking at on the screen whenever we cough, laugh, jump, sneeze, or lift something heavy. So whenever we do any of those things, there's going to be a certain amount of pressure that goes into the core system, and that should be well managed by transversus abdominis, the diaphragm, pelvic floor, and also the spine. So if we have a problem with any of these pieces of our core, we're going to have a problem with the whole core. And so as you can imagine in pregnancy, even just talking to you all right now, I'm like out of breath because the baby is actually like in the diaphragm, and also back stiffness and other things like that can compromise how well our diaphragm can expand, and we can become a little more reliant on more shallow muscle groups. And then that can also impact how our transversus abdominis fires as well. So the breathing, the deep core activation, it's all very, very connected. And I'm going to show you a few exercises here today, how to coordinate these things and bring more awareness. Because if we have problems with any of these systems, that's when we start to develop P leaks, pain, prolapse, and diastasis rectus, diastasis recti. I always change that up depending on, I don't know, my mood, I guess. Anyway, so I know that's kind of complicated. We're going to be reviewing that frequently. So just also pop questions, whatever questions you might have in the Q&A. Okay. let me just check that really quickly and see if there's anything. Okay. Is there anything we can do pre-pregnancy to help with pelvic floor and abdominal strength during and after pregnancy? Elizabeth, yes, there is. There's so much you can do. Um, Let me come back to that at the end and we'll talk a little bit more about that. Alrighty. Okay, so let me see. Okay, there we go. All right, so that's kind of why we need to activate our deep core is because good activation of transversus abdominis is going to decrease back pain and pelvic pain in pregnancy. It's going to decrease the severity and risk of ongoing diastasis recti postpartum, and then it's going to increase strength and stability during your pregnancy. Remember, it's very, very physical. Pregnancy is a lot of work. Child raising is a lot of work. This is so silly. But I was watching that like Blue Zones on Netflix, and they're just talking about how, people in Costa Rica, the spot of like Costa Rica, are doing a lot of physical labor and gardening and things like that. And I don't know, it's sort of that manual labor. It replaces the need to go to the gym and things like that. And honestly, I was really thinking about being a parent, especially a mom. Um, and it's just like it's so physical. It really, really is. And to be doing all of this physical labor without being feeling like you're doing your best as far as like having a pain-free postpartum period or pregnancy or it just makes it so much harder to show up for your kids. And so for us, it's just so important. I get apparently not just for longevity, but for just being the parents that we want to be to not have a bunch of physical health problems. Pregnancy is already hard enough. We just don't need that. So the other little perks of having a nice, strong core system, once again, when we're thinking core system, we are thinking about our rectus abdominis and obliques, like all of those muscles that are really pretty that they airbrush on models and things like that. Like, yeah, those matter, but they don't matter as much as being able to activate your deep core system. The deep core has to be first. We can't just be all six-pack abs. It's not functional. So I always like joke that, if you see somebody at the gym and they have these beautiful six-pack abs, but they don't really have anything else going on, they're like designer abs because they're not that functional. They don't work to keep the spine safe. They're not able to really protect your pelvic floor. And at the end of the day, if we're overly reliant on our superficial abdominal wall, so rectus abdominis, six-pack abs, obliques, and we don't have any firing from our deep core, first, what we're going to get postpartum is a lot of like distended belly, mommy tummy. So even if you don't actually have a gap in your abdominal wall postpartum, you may still have a belly that you're not super happy with because of this faulty firing pattern. So once again, we really want to look at that breath. We want to look at the coordination of the breath to the transverse abdominis and also ultimately the pelvic floor. So strong abs may assist in pushing during labor. Of course, you can imagine it's going to be, we'll talk about this a little bit later, but a whole lot about the exhale for the push. Good core management during pregnancy can help decrease your risk of developing prolapse and urinary incontinence, both during the pregnancy and postpartum. Urinary incontinence is our pee leaks, coughing, laughing, jumping, sneezing, or feeling like you're going to pee your pants on the way to the bathroom, things like that. Or like if you hear water running, all of that is considered urinary incontinence. And then also, I mean, just having a huge leg up on the postpartum game, like I talked about, it's really not a great idea to go through your whole pregnancy without knowing any of this information, which isn't any of you because you're all here, but because postpartum happens like really quickly, and then you have a newborn, and then you have this huge car seat, and you've got like all this stuff you have to do, and you just went from being pregnant for like 9 months to not pregnant in just a few days or hopefully a few hours. But it's still, even if it's like a long labor, it's very quick compared to how long it took you to become as pregnant as you were when you gave birth. So it's going to accelerate your postpartum healing. You're going to be so much stronger and better for it if you know how to activate your core during pregnancy. All right, when to start? As early as possible. Like we talked about, on it, like before the pregnancy is ideal. I can kind of answer that question now. What can we do before pregnancy? You can do all of these same exercises before pregnancy. You can, what I would recommend if you're thinking about getting pregnant is making sure that you're addressing anything that has been going on for you chronically, like back pain, if you've already had P leaks, if you have pelvic floor stuff like pain with sex or anything like that, or if you have any pelvic pain or hip problems, go ahead and see, a pelvic floor PT to get that sorted out. And then if you're totally good, then you'll do these types of exercises, but also incorporate them into exercise routine. I recommend trying to start that 3 months before you get pregnant, like a 3 day a week kind of physical activity exercise regimen. So yeah, good questions. All right, let's do this. Okay, so let me just, how do I want to do this? I'm gonna exit out of the screen share. You're just gonna see me. I'm gonna move to, let me check the Q&A for anything. Okie dokie. Okay. Let me just check the chat again. I don't know why it's disabled. We're gonna go with host and panelist and then everyone. All right, so Q&A questions for these exercises. We're going to get into exercises now. I'm going to show you three. So the first one is going to be a breathing one. So I'm going to take off my jacket and I'll just be watching the screen for any pop-ups for the Q&A. If you have available to you a ball or a chair, depending on where you are in your pregnancy, I would recommend I'm going to do it all on a chair because I'm in my third trimester, but I would say if you are earlier than your third trimester, you can go ahead and move onto the floor on your back, or you can just sit with me. That's also fine. All right, so let's do this. Okay, so the first exercise is going to be all about the diaphragm and the breath. Okay, so I talked a lot about how the breath is such an important component of your core, and it really, really is. So our first exercise is going to be breathing 360 degrees into the thorax. And during pregnancy, problems arise primarily in the back, okay? So we can often breathe into the belly or breathe into the neck and shoulders, but we can't breathe into our back because we're just kind of doing like this type of thing and we're getting really, really tight. So most of the time we need to be thinking about breathing more into the back body. But what we're going to do for this one is we're going to take our hands and we're going to put them around the circumference of your bra line. So your bra line is a nice example of where your diaphragm is kind of sitting, and it cuts our body directly like horizontally 360 degrees. So putting your hands on the bra line can be a helpful place because not only are we going to be using the bra line as almost like a weight training for a diaphragm, because we're going to be pushing out against it, but it's really sitting like right where the diaphragm is. Anyway, all right, so I'm going to put my hands on the bra line, and what I'm going to do is just work on inhaling into really mostly like right here is where I'm the tightest, but you might be thinking, oh, my ribs don't really move out to the side or they don't, move into the back. So we just want to take some deep breaths. We're going to feel the ribs expand into all the tightness. So if you want to, just for fun, type into the Q&A if you're having trouble in one specific place. Like for me, it's my back, my upper back. And tell us where it's hard to breathe. And that's exactly where you're going to want to breathe more of. This can be an exercise that you'll want to do in the mirror as well, because I also don't want you all to be breathing up into your neck. So it's really down here, the bra line, once again. And it's not up here. And sometimes we're so used to this that we don't even know we're doing it. So it's nice to have a mirror for feedback to do this exercise for that purpose. The other thing is that belly breathing is not necessarily a deep breath, nor is it very diaphragmatic. Okay, so belly breathing is going to be easy for us right now because the belly is distending forward. So we can breathe into our belly, but we really don't want to do that because we already have a lot of like forward motion. We want to be thinking about expanding into all these other places. And the more that we can expand into our tight spots, the better we're going to be able to contract our deep core. So give that a couple tries. I want you to do that for 5 to 10 minutes every day. And then let me know if you're having any difficulty with spots there that are tight. Um, what else did I want to say about that? Yeah, so into the diaphragm, and you're just going to be seated, maybe looking in the mirror, just making sure you're not breathing up into the neck and shoulders. Another benefit of doing this exercise in 5 to 10 minutes a day, just breathing 360 degrees, is that it's going to decrease the amount of hand numbness you might be getting and also neck and shoulder and upper back pain. Because if we're really shallow breathing because of the pregnancy, doing a lot of that, we're going to be creating a lot of shoulder tension, a lot of jaw tension. We might be rounding in our upper backs more and more because we're just getting so stiff back there. And that can kind of compress the nerves and blood vessels that come out of the neck and innervate the hands. So if you're having a lot of kind of carpal tunnel symptoms or hand numbness, this is one that you're going to want to do. Alrighty? Okay, so don't forget questions into the Q&A. I'm going to move on now to activating transverse abdominis. All right, so this could be a little tricky. I got kind of a big belly right now, so hopefully I can show you, but I will try to show you in a few different ways. After we do a really beautiful inhale, so I'm gonna try to inhale once again, mostly into my back. Oh, and another thing about the inhale is I don't want you to be like lifting forward with each inhale, okay? That's another really shallow way to breathe. And so we don't want to be reinforcing like this back tightness by using our back to inhale. So I want to breathe backward into my back and expand through the back body. See, it is possible. All my clients are like, what are you talking about? I demonstrate that I can actually breathe into my back, right? I have to practice it a lot and I have practiced it a lot, but it's possible and it will do amazing things for you and your core. Okay, so once you've mastered that inhale, on the exhale, we're going to work on activating our deep core. Now remember, transversus abdominis comes from the spine and wraps around the belly like a big corset hug. When women wear those belly wraps postpartum, they're essentially trying to reproduce our deepest abdominal core layer with a belly wrap. Now, we want to be thinking about lifting baby from the bottom up. I don't want to see a bunch of like upper ab gripping the baby from the top up. We got to see movement from down here. And the better the inhale you have, the easier that's going to be. So we're going to inhale. And on the exhale, we're going to hug belly into spine. And we want to think about lifting baby up towards your head. So we're going to inhale, exhale, lifting up towards your head. And then once again, you can see it's getting so hard for me because baby's getting so far forward that I wanted to like do this to try and bring the baby up to me. But that is, although it is something you're going to always want to do because this is where we're the most mobile in pregnancy, if we bend down like this, we're going to put downward pressure on pelvic floor and we can really make things worse for our pelvic floor. So we want to stay open and tall through the upper body. Inhale, exhale, lift baby up. So I'm going to go ahead and stand up for you all because I think you can see it better in standing. So I'm going to inhale and like, let me put this ball, it's like coming for me. Okay. So we're going to inhale into the back, exhale. There, yeah, that's a little better. So hopefully you can see how I kind of lifted the baby from the bottom up towards my head. And I'm going to inhale, And you can go ahead and let it go on the inhale. That's totally fine. There may be some circumstances in your life where you don't want to let it go on the inhale. But remember, we're inhaling into our back, so we don't have to let it go. Um, but if we want to move through the full range of motion of the abdominal contraction, we can let it go on the inhale, and that may help with some strengthening. So we're going to inhale again, exhale. And for me, since I had a C-section with my daughter, I can even feel some stretching in that C-section scar, like down in the hip flexors, because I'm actually lifting the baby off of my hip creases with that exhale and those deep abs. All right, let me check any questions. Q&A. How are we doing so far? Um, you all hanging in there? Keeping keeping pace with me? Okay, good. Okay, so that's 360-degree breathing. That is transverse abdominis activation and how those two intertwine. Let's go ahead and add some real exercises on top of that. So, real exercises. Well, they're all real, but these are going to be ways to challenge your ability to stay activated in that deep core system. So, I'm going to come back to the ball and I'm going to be sideways. So, now we're going to inhale into the back body. We're going to exhale, lift baby up towards the head, hold it, and I want you to see if you can march a leg. So now we're just trying to see, can you maintain your abdominal wall contraction and move a leg? So it's not like we're doing anything crazy, we're just marching, but do you let it all go when you go to march? Do you come into a bunch of doming in the abdominal wall when you go to march? Do you maybe hold your breath? We want to kind of flow through this, integrate both the exhale and the march at the same time. So we're going to inhale, exhale, march. Inhale, exhale, march. Inhale, exhale. And another thing to be watching for, especially in a seated position, but also if you're lying on your back, do you wobble and rock all over the place when you march one leg versus the other? So for me, I have kind of a harder time marching my right side. You can see I really struggle to stabilize with my left core when I march my right leg. Whereas my left side, I can stay really centered. So I definitely have some asymmetries going on here. So some things you might notice are how much you might need to breathe a little bit more like into your right side than your left. I'm a lot stiffer on my right side. I think I'm sleeping on my left side. I've been sleeping like this, like for the past few months. And then also, if you have some left like core weakness, or maybe you need to squeeze your inner thigh, and that's all stuff that gets a little more complicated. But it's just interesting to notice. Do we have asymmetry side to side? Okay, so that's marching. We're gonna do some heel slides now. So same kind of concept. I'm gonna back up so you can see me. Okay, so we're gonna do some inhaling, exhale, and I'm just gonna slide a heel out and back in. So this one's actually a little bit easier than the hip flexion because we're not actually leaving the ground with our heel. We're gonna inhale, exhale, left side, inhale, exhale, right side. Inhale, exhale, left side, inhale, exhale, right side. Okay, so those are two exercises that you can do every day to help build core stability and core strength. I want to just demonstrate for you really quickly how that might manifest into your daily life. So I'm 35 weeks pregnant. Let's say I'm on the floor and I want to get up. Okay, so I'm on the floor and I want to get up, but there's nothing to hold on to. So what I'm going to do is I might come to tall kneeling and I'll inhale, exhale, lift up my baby, and then I'll come to standing. And that's going to be a whole lot easier to do than if I was like, bearing down, and that would put like pressure down into my pelvic floor and forward into that abdominal wall and create more of an abdominal separation. So we want to also be lifting our other kids like that as well. So if I have a kid at home that I need to lift, I might inhale, exhale, pick baby up, and then I'll lift the other one, making sure that my belly is nice and lifted up toward my head and that my breath is flowing and that I'm not holding my breath. All right. So that is how to activate your core during pregnancy. I'm going to go ahead and screen share again, and we can review those. Whew, I'm out of breath. Exercises on the there we go. Okay, on the slide. So we have breathing 360 degrees into the rib cage, not the belly or the shoulders. Once again, do that one in the mirror just to make sure that you aren't super shallow breathing. This is going to help you so much. Back pain, better core activation, neck and shoulder problems. I had so much grinding in my jaw during my first pregnancy that I had to get braces afterward because I was just like so tight and not breathing all that well all the time. So not saying what's going to happen to you because, I have like my own orthodontist stuff going on. It's just incredible, how things can change and how important good breathing is for everything, especially during pregnancy. And that's, I would say, 5 to 10 minutes a day if you can. I always do like for time with these exercises because it's like very tedious to be doing 3 sets of 10 marches. Just do it for time. So hugging baby, that's the one where we were seated and we're going to exhale and then we're going to hug baby and lift up towards our head 5 to 10 minutes a day. And then we're going to challenge the system with marching and heel slides. So this whole thing should take you 15 minutes tops, maybe even less. Just want you to start getting it into your head. This is how we should move. This is how our core should work together. And these are the things that we should see. And we really shouldn't see once again. And if we're doing these exercises, especially in the third trimester, no coning or doming. So coning or doming is going to look like a little cone poking out of your belly. It could be at the top. It could be toward the bottom. We really don't want to see that during these exercises. That may happen third trimester if you're on your back trying to get up. But if we're working on a deep core activation, we really shouldn't be seeing that. All right. So what else should you be doing during pregnancy? There's a whole lot to know. There's a whole lot to learn, especially when it comes to protecting your pelvis and your back and your abdominal wall during pregnancy. So to answer those questions, I have put together a prenatal course to help basically fill the gap between like, how do I exercise? What do I exercise? What do I do? What's safe? What do I focus on? What matters? And this is all coming from the perspective of being a pelvic floor physical therapist and like seeing all these problems that all the things that could happen. And being able to say like, this is what I would focus on like during pregnancy, like these are the muscle groups, this is the posture. And when I go onto like YouTube, for example, and I'm Googling prenatal exercises, it's like there's these ladies and they are not pregnant and not, you're not always pregnant. So like, of course, like you can be a fitness specialist and pregnancy and not be pregnant because you're only gonna be pregnant for so long. But at the same time, it's like, I don't know that those cues are ones that I would give. So I went ahead and made my own prenatal course for you all to give you the cues and the information that I think is super important during pregnancy. So the things that we go over in the course are how and when to exercise during pregnancy, who is a candidate, what like where should you be exercising, what should you be focusing on, what risk factors matter, things to know before you start. What's important? What muscle groups? Like, what do I need to work on? Like, I would always say, the inner thighs and the abs and the breath and all that stuff. But then it kind of changes during trimesters as well. Like in your third trimester, we might be doing a little more weightlifting, for example, because you have more testosterone at that time and you need to build muscle mass. So there's this like little things that I have in this course that are often not included in prenatal information. But the other benefits of this course are because I'm focusing on these really specific things, you can also learn how to protect your pelvis during pregnancy, reduce the amount of pelvic pain that you might have, how to lift your kiddos at home in a safe and healthy way, and just decreasing your back pain and having a better pregnancy. Like I said, it's really hard for us to show up as parents when we're not feeling great in our own bodies. And so I think this is so important. Um, and then the last part of this course that I'm so proud of is basically how to prepare for birth. So I go over all the different ways that we can help reduce your risk for tearing during a vaginal birth, and reducing your risk of cesarean section if you want to avoid that by gathering a birth team and who should be on it and when you should be doing that. Perineal massage, I think, is a really powerful technique to help open up the pelvic floor and decrease your risk for tearing. And I have a whole tutorial on it, what it means, how to do it, when to do it, and how often. And then also little tips like a warm compress on the perineum during labor and just different positions to be in during labor to have a more optimal birth. So right now, if you go ahead and purchase that prenatal course, it is $140. You will also get free unlimited access to my prenatal workout database. So I have built this database to help give you just 20 to 30 minutes of workouts that are targeting areas that I think are super important, that really take minimal equipment, maybe a block, weights, light weights. You can do them at home. You can do them with kids around. It's super easy. You can do them, you can travel, you can do them anywhere. And I'm doing them pregnant. I'm doing them with you. And then they are like based on trimesters. So like, here's what you would do in first trimester, and here's your second, and here's your third, and trying to give you really good cues on how to activate the systems that I want you to be activating during your pregnancy. So for all of it, it's $140 one-time purchase. And if you are interested in that, I want you to go to www.holisticpelvichealthpt.com/prenatal course. And I will go ahead and pop that in the chat. Of course, that would happen. So it is www.holisticpelvichealthpt.com/prenatal course. And then I'm also going to send that through the Q&A. Oh, I don't think I can actually. Never mind. So it's www.holisticpelvichealthpt.com/prenatal course. All right, everyone. That is what I have for you today. So if you have additional questions, put them in the Q&A and I will answer them live. If not, then thank you so much for joining me. I hope that was valuable and you got some really good information out of it. And I'll see you in the prenatal course if that's something you're interested in. Actually, one other thing I wanted to show you, if while we just wait for some questions, this is what it looks like. So here is, if you join, you'll see this as your courses. So you can go to Preparing the Pelvis for Birth course, and here is like all of the things that we go over. So time management for busy moms, who should exercise, how to deal with the fact that you're exhausted, and exercise around that. We're going to go over more extensive information about core work and diastasis, different types of breathing. Today, we kind of talked mostly about back body breathing, but this course is going to have more information around that. And then a review on the whole lower ab activation, how to decrease pelvic pain, and then a bunch of different exercises for pelvic pain if you are experiencing that. Lifting mechanics, early versus later, preparing the pelvic floor for birth. Once again, perineal massage, how to push, your birth team and your birth team. And so all of that is here in the course. And then you can go into the workouts and you can check out all the different workouts I have, like for the first trimester, second trimester, and I update this regularly. So you will have access to like new stuff, even though it's just $140 flat fee. So once again, that's holisticpelvichealthpt.com / prenatal dash course. All right, so that's all I've got for you. I'm gonna go ahead and sign off from this. And thank you again. I hope to see you all in another webinar. Take care.